Hi there. Thank you all for joining me today. My name is Tiffany Hall. I'm zooming in from Anchorage, Alaska, and I want to acknowledge the Dena'ina people on whose unceded ancestral lands I am lucky and grateful to live, work, and raise my family. I'm the Executive Director of Recover Alaska, an organization working to reduce excessive alcohol use and harms across the state. We do this at the system level through advocacy and policy change, increasing access to care, leading a statewide alcohol misuse prevention alliance, and social norms change, reducing stigma and celebrating recovery. Today, I'll be talking about alcohol taxes, what we've learned, and the steps we took to pass an alcohol sales tax in Anchorage last year. I'm going to start with a couple fast facts about alcohol to ground us in the importance of reducing its negative impacts by any and all means necessary. Alcohol is the third leading preventable cause of death in the United States. An estimated 95,000 people die every year from alcohol-related causes. These deaths have been steadily increasing over the past 20 years, up from roughly 36,000 in 1999. Equity matters, and disparities exist. Alaskans are dying from alcohol at a rate over twice as high as the national average. Alaska Native people are dying at a rate nearly 10 times higher. Suicide is the leading cause of death among Asian American adults, and problem drinking is rapidly on the rise in this population. But they are the least likely to receive treatment and are seen as a low-risk group due to the myth of the model minority. LGBTQIA folks are overrepresented in alcohol use disorders. Many people know alcohol is related to liver disease and fetal alcohol spectrum disorders. Many people do not know that alcohol is also related to heart disease, stroke, diabetes, mental health disorders, fertility issues, and is a carcinogen. The estimated association with breast cancer is an approximate 30 to 50% increase in risk from having 1 to 2 drinks a day. Drinking alcohol in moderation means 2 drinks or less in a day for men and 1 drink or less in a day for women. Drinking less is better for your health than drinking more. Anything you hear otherwise is likely funded by big alcohol. There are some adults who should not drink alcohol, such as people who are pregnant. There is no safe level of alcohol during pregnancy. Or me. I'm a person in long-term recovery from co-occurring alcohol use and anxiety disorders, and it's better for everyone, especially me, if I don't drink alcohol. Teens aged 12 to 20 drink 11% of the nation's alcohol. 65% of youth obtain alcohol from friends and family. The number one thing you can do as a parent or trusted adult to reduce underage drinking is talk to your child about alcohol. Not once, not twice, often. Make it part of regular conversation. Don't tell them they can't have it because you said so. Tell them young people can't drink because their brains are still developing until age 25, and alcohol and other substances can so easily rewire them. There is no evidence that allowing your children to drink in your home will make them less likely to binge drink at college. There is research showing that the younger a person starts drinking, the more likely they are to develop a disorder. Alcohol consumption has increased significantly during the pandemic. Nearly a third of households that drink alcohol increased their consumption due to stress from COVID-19. So, why an alcohol tax? In short, because they work. An alcohol tax does not ban alcohol. It simply collects revenue to recoup some of the costs to the public for alcohol misuse. Not only do alcohol taxes reduce drinking, but they also reduce some of the harms of drinking, such as the incidence of vehicle crashes, especially among young adults, sexually transmitted diseases, and alcohol-related mortality, such as liver cirrhosis. The alcohol tax is essentially a user fee. Those who do not drink pay nothing. Those who drink in moderation pay little. And those who drink to excess would pay the largest portion of the tax. This deters youth who are price sensitive from attempting to purchase alcohol, and it also deters heavy drinking as it makes the price per drink slightly higher and promotes more moderate drinking. The evidence base has been established over 4 decades of nationwide research and is detailed in multiple reports, including empirical studies of United States alcohol tax increases. As a public health strategy, taxes are endorsed by all the leading authorities. What are alcohol taxes? There are 2 ways that government taxes alcohol: excise taxes and sales taxes. Excise taxes are levied on the amount of liquid, typically a per gallon tax. Rates can vary based on alcohol content. They are paid at wholesale by manufacturers and distributors, not retailers. They are typically vulnerable to inflation, and the value collected over time will decrease unless it is indexed for inflation, which is rare. So write it in if you push for an excise tax change. Sales taxes are levied on the value or the retail price and are paid by the customer at the point of sale. Sales taxes are not vulnerable to inflation. Some places have a general sales tax. Some include alcohol in this, or give alcohol a separate rate, or add an alcohol sales tax on top of the general sales tax at a local level. All of this is pretty locally dependent, so you'll have to look into what's true in your own state. In addition, there's a federal excise tax on alcohol, as well as possible state-level excise taxes on alcohol. Federal alcohol taxes haven't been raised in 30 years, despite being one of the best public health policies to reduce alcohol-related deaths. Like all excise taxes, they have lost significant value over time. Additionally, Congress recently made a temporary alcohol tax cut permanent in 2020. Just to show you what I mean about indexing for inflation, you can see these numbers from Alaska. We last increased our state excise tax in 2002 to 60 cents for a 6-pack of beer, depicted by the red line. We still collect just 60 cents, while the price of that 6-pack has increased over time. The blue bars indicate if that tax had been indexed for inflation. We would be collecting 82 cents on the 6-pack. The alcohol industry knows all of this. They know how much money they're saving. They know how much money the public is saving. They know that taxes will reduce excessive drinking, but they need excessive drinkers to make their cash. They're not getting rich off the people who are having 1 drink a night, maybe 4 drinks a week. They're getting rich off the people who are drinking 10 drinks a day. 30% of American adults 18 and up don't drink at all. Another 30% consume, on average, less than 1 drink per week. The top 10% of drinkers are consuming 75% of our nation's alcohol, nearly 74 drinks each week. Excessive alcohol use is often or only talked about as an individual choice and a personal moral failing. This stigmatizes the disease of addiction while also not beginning to address the systems of harm like poverty and lack of adequate housing and access to education, systems like white supremacy, patriarchy, and colonization. I'll save my thoughts on that for another presentation, but solutions to combating big alcohol must be grounded in the same firm beliefs as the fight for equity: fiery activism, relentless hope, and unyielding resistance. You have to act as if it were possible to radically transform the world, and you have to do it all the time. The work of being an advocate for public health against big alcohol is so daunting. They are incredibly powerful. They have legislators in their pockets and people drinking up whatever they're putting down. But the evidence is clear that an alcohol tax is one of the best things we can do to reduce death and disease related to alcohol. So in Anchorage, we got to work figuring out how to take on the alcohol industry and pass a tax. And my strongest tool ended up being data. We started polling in 2016. The governor of Alaska at the time included an increase to our state's excise tax in his preliminary budget, and we immediately did some sampling by region to see where we'd have partners if the tax got traction in the legislature. It didn't, And it did begin the semi-annual warnings I received from our state's largest alcohol industry that they would have $500,000 by the end of the week to fight us if we ever considered a tax. But we learned something critical. The majority of people polled were strongly in favor of increasing an alcohol tax if funding went to treatment and prevention. People were also somewhat or much more likely to support a candidate who favors the alcohol tax. We continued to do polling both statewide and locally in Anchorage for the next 5 years. We used 5 different pollsters to ensure we didn't have hidden biases and to ensure that we would have data a person would trust no matter where they stood politically. We kept getting the same results, that the majority of voters were in favor of an alcohol tax, and yet we kept losing. Creation of an alcohol tax in Anchorage failed 8 times at one step of the process or another, including a loss in 2019. The mayor of Anchorage at the time was in charge of that one. We had supported their team with everything we had, all of the data and information we'd been collecting, but we didn't own the political action account for the campaign, so our hands were kind of tied when it came time to run the campaign and get the thing to pass. And it failed 54 to 46% at the ballot box. After that vote, right after that vote, we did an after-action analysis of the campaigns, the yes and the no. The biggest difference was funding. True to its word, the alcohol industry quickly raised over $340,000 for their anti-campaign, including multiple donations from big alcohol in the lower 48. Meanwhile, the mayor's campaign fell flat and raised just $32,000, despite many of us looking for ways to contribute and participate. The mayor teed it up and then essentially just set his team up for failure by not championing it through the end. Right away after the vote, Recover Alaska gathered all of our partners and the potential partners, asking who was in, given how close we got with basically no campaign. Who would lend their time, strength, connections, energy, and asked if they wanted us to lead or someone else. We had over 30 partners in the room saying, yes, we want to do it. Yes, you should lead it. So we got to work. We did some polling directly after the vote. We broke down the data by voting district and cross-referenced it against other progressive initiatives and candidates to see where we had failed or where we could make up some ground. We were trying to understand what would keep the yes votes and what would sway just enough of the soft no votes. We asked things like if a sunset on the tax would change their minds, or mandatory evaluation reporting, or property tax relief, whether it mattered to them that alcohol taxes save lives. We asked where they get their news. Then we targeted the population that was on the fence. The population that told us in the polls they were in favor of a tax, but on voting day said no. The population that ended up being swayed by the industry's marketing campaign. We called on our friends. We called Vinnie DeMarco, Michael Sparks, David Jernigan, and Bruce Livingston. We asked for help, and I encourage you to ask for help. It is out there. All of those folks I mentioned were so willing to talk to some random person calling them from Alaska for help. But there is plenty of help and support out there, and people are so willing to lend their expertise and experience. We ended up loosely following the 6 steps for effective advocacy in Maryland, which is well documented and I highly recommend. We polled again, asking where people wanted the funding to go, and left no possibility off the table. A key piece to Recover Alaska running the campaign is that we didn't have a dog in the fight for revenue. We would fight tooth and nail for a tax, even if all the money went into a hole in the ground, because the tax itself is the public health win. This made us a compelling advocate and open to all partnerships. Did people want the money to go to schools, or for roads, for prevention, for flowers in town square? In Anchorage, people wanted the funding to go to prevention of child abuse, sexual assault, and domestic violence. Also high on the list among the population we were trying to sway were police, treatment, and homelessness. Remember, some folks were voting yes no matter what, some folks were voting no no matter what. And we were trying to capture those folks who were on the fence who we could potentially sway. Then we needed to find our local champions. We had considered gathering signatures to get it on the ballot that way, but we learned that in Anchorage, if we did that, we couldn't dedicate the funds. and that was one of the most critical pieces of the campaign. So we needed strong assembly support in order to get the issue on the ballot just 1 year after it had failed. So again, I relied on my data. I told our champions exactly how we were going to win. I told them that their constituents want this. And I told them that if I don't have enough money raised by the night of the assembly vote, I would ask them to vote against it. That was my commitment and accountability to have $200,000 in the bank, with plans for more on the way. I have to say, I included this photo because when I did a search for stock images, this one came up, and I think it kind of hilariously looks similar to our 3 assembly champions, as an aside. So I talked through our ideas about revenue with them, and I let them make the final decisions based on assembly priorities and to ensure that they felt empowered and bought in to really lead the initiative. Because of a line in Anchorage's charter that states that any new taxes would need 60% of the vote at the ballot box, we needed to include a charter amendment in our proposition language, which meant that we needed a supermajority of the assembly to pass it rather than a simple majority. So super assembly of the majority meant a simple majority of the people, and vice versa. I'm telling you this because I just want to highlight that there are a number of local specific rules and regulations that come with doing a local alcohol tax, but the juice is worth the squeeze. So just do your research and figure out these limitations up front. Parallel to ours, another organization was working on a general sales tax, and they had initially done a better job of outreach to the community and getting community councils on board. They had some money in the bank before we did, but they didn't have a sponsor on the assembly, and they didn't realize that the Budget Advisory Commission couldn't put things on the ballot. So their months of work were washed down the drain in one failed assembly vote. So for a local tax or state level for that matter, find your legislative champions first, or for an alternate route like signatures, or you're sunk before you really get started. We also made sure to look into things like which other cities or boroughs within Alaska were already taxing alcohol to preemptively negate the claims that people would stop drinking in Anchorage and drive over an hour away to another town, or that it would really negatively impact tourism. So once our assembly sponsors finalized our 3 buckets for funding, we then polled again, asking how people wanted us to talk about those issues, which words and framing we should use that would get us those swing voters. Who was the right messenger? Could we get a local celebrity? Would that matter? We also asked how effective the industry's campaign was. Which of their messages from the prior year had sway power? Which ones should we respond to and how? And which should we just let go of and stick to our own talking points? This also led us to a few other aspects we wrote into the proposition to give us the best chance of winning without negating the public health impacts of the tax. So we made clear it cannot be increased and dedication cannot change without a vote of the public. There will be mandatory annual reporting on what happens with the revenue. None of the new revenue can supplement current funding, so there would be no municipal shell games. And another assembly member had proposed and passed a detailed process for public participation to help determine exactly where the revenue would go if Prop 13 passed. These ended up being our key talking points at our many, many, many presentations. We hired a group to run our campaign, led by previous Senator Mark Begich for his fundraising connections and his ability to spin words. While my instinct is to combat falsities with facts, his experience said to stay on our statements and make statements that are truthful, whether or not they're really related to the question. So when they said, "We don't trust the government spending this money," we said, "We're changing the city charter. We're dedicating the revenue so they can't mess it up." The charter change was really about getting the simple majority, but this talking point kind of helped kill 2 birds with 1 stone. We garnered many partners across subject matter and sector, such as the Alaska Children's Trust, our primary partner, the Firefighters Union, Brown Jug, a local liquor store chain, as well as nurses and teachers, an Alaska Native Justice Organization, and a faith-based community. We had a volunteer op-ed czar who was working with leaders from every viewpoint, drafting letters and getting them in the paper every other week. We used every connection we had to try to get us earned media alongside our paid campaign. We had a volunteer analyzing polling data every possible way that could be imagined, and other folks who were throwing fundraising and fundraising house parties. Anyone who wanted to give their time and energy and funding, we accepted and put them into the fight. Some partners were giving their own presentations and highlighting the aspects of Prop 13 that was important to their own mission in order to get their supporters on board, or they were setting up opportunities for me to present. Right up until the week I was pregnant and due to have my daughter, who, by the way, was on the outside by voting day and stayed up all night with me to watch elections come in. This does bring up a good point about having a solid team. My daughter Margaret was born 3 weeks before voting day and 5 days before Anchorage went into hunker down due to the pandemic. So I was 100% out of the picture, and I didn't worry at all. This effort was so much bigger than me all along, and by then the champions were in place to see it across the finish line. I can never take all the credit for this alcohol tax, and it was only because of all of those other champions leading the way that we had the success that we did. We set up a separate account for all of our donations to go to. We would have loved to find a 501c4 partner, but none were willing or able to take up our cause. So we set up a separate account for that, and we needed a chair for the campaign whose name people would hear every time an ad ran saying they approved it. One of our toughest audience that had the potential to sway were elderly conservative voters in the faith community who didn't like taxes, but also didn't care much for alcohol and who distrust the government. So we found a spokesperson for that demographic, a conservative, elderly, white male doctor who was against the tax the year before, but changed his mind because of how we were dedicating the funds. A delightful man named George Rainier, who I'm very grateful to. We also chose our face of the campaign based on polling data and the aspect of safety and prevention. A mom with young kids. We were lucky to get Holly Brooks, who's also a local celebrity as an Olympic cross-country skier and a strong advocate for girls in sports. Just another thing important to note, polling, research, and education can all be funded free and clear by any funding source. We are allowed to run educational campaigns alongside lobbying campaigns and can use things like dollars from private foundations for this. We just need to study up on local needs around recording and reporting. And nonprofits are allowed to lobby. They are allowed to tell people how to vote. They're allowed to talk to legislators. It just has to be under certain dollar amounts, depending on the level of government, and has to be recorded and reported. But there is a lot of fear around that in the nonprofit industry, and it is really inhibiting. And I think one of the things that's holding us back as a sector. So I would encourage you all to meet with your local office and figure out what is true in your location, how to do the reporting, and how to teach your other fellow nonprofit folks how to do that as well, or whichever organization type or sector you're in. And some of these laws can vary locally, and ours aren't written down in a very clear way, meaning that we got different answers from the Alaska Public Offices Commission every time we called. And eventually we got pinged for lobbying in an educational ad on Facebook, and we had to pay a fine. That error made front page news, and multiple colleagues called me to say, welcome to the fight. You know, we don't know anyone who's run a campaign worth running who hasn't been fined. So just to say that it feels scary, but it's not the end of the world if it happens. And again, all of it is worth it. And then it was voting day. On April 7th, 2020, after 8 failed attempts in the past 25 years, Anchorage passed a 5% retail sales tax on alcohol. It took effect on February 1st, 2021, to avoid complications of figuring out how to start a new system at the bars on New Year's Eve at midnight. And it's currently on target to bring in at least $11 million. Likely more. Celebrate your wins. Even if you don't win, celebrate all that you learned so that you can try again. People's blood, sweat, and tears are worth recognizing, and treating people to baked goods or yoga class passes or whatever your remaining budget will allow is definitely worth it. The icing on the cake for us came afterward, getting to lead a coalition of nearly 200 stakeholders, intentionally inviting Indigenous and Black leaders and other leaders of color, the LGBTQIA+ community, and people with lived experience of homelessness, poverty, and addiction to establish a citywide theory of change for how to spend the revenue today for the biggest impacts tomorrow. The tax will raise roughly $12 million annually, and revenue will go to a mobile crisis intervention team able to send mental health professionals to certain emergencies rather than the police. It will go to prevention of child abuse, sexual assault, and domestic violence. It will go to homelessness services and to treatment for substance use disorders. And it will go to a new position, a chief equity officer for Anchorage, to begin dismantling our systems of oppression. Some people might push back on that as falling outside of our three buckets, but a strong case can be made that race-based disparities impact every single issue in this theory of change. And if we don't start addressing them, we will never see the long-term impacts we're all working toward. Like many campaigns, to pass an alcohol tax, you have to change hearts and change minds. My biggest takeaways from the campaign were polling. Polling won us the election. It got us our assembly champions by proving their constituents wanted this. It got us funding from diverse sources. It earned us new partners. It perfected our messaging, and it got us the votes. Second, decide your must-haves up front and then let go of some control in order to build stronger and more equitable partnerships. And third, it has to be an all-hands-on-deck priority. You have to want it more than you want anything else throughout the entire campaign. You have to be relentless. I mentioned earlier the huge power of big alcohol and the drive it takes to stay focused. This work of being an advocate, especially for people who are unseen, who are generally relegated to windowless church basements and hide in anonymity, this work is heavy and filled with trauma and lonely. And it's so big. Alcohol is ever present, and its harms are ubiquitous. It feels intractable. No one takes on big alcohol because it feels so incredibly impossible. But in 10th grade, I wrote a paper on Muhammad Ali, so I know impossible is nothing. He said, impossible is just a big word thrown around by small men who find it easier to live in the world they've been given than to explore the power they have to change it. Impossible is not a fact. It's an opinion. Impossible is not a declaration, it's a dare. Impossible is potential. Impossible is temporary. Impossible is nothing. Thank you so much for your attention today and your work year-round, and for any interest you might have in an alcohol tax. The more we can create them and raise them around the country, the better.